drinking advices, you need to tell them that what drinking advices, don't drink too much or at this time, and explain everything bit by bit in hangover headache. Carbon monoxide, the situation would be not a medical situation, not like the patient would come just with the mild symptoms of carbon monoxide poisoning. So the treatment is that I would like to give you high flow oxygen and occupational therapist, and I would like advise you not to go to that home until it's being fixed. So that is carbon, and again you can give paracetamol as well. Sinusitis, again you will give nasal spray. If discharged, antibiotic and steroid. Antihistamine you can give because it's related to the allergies. And management of subarachnoid hemorrhage. If it is a subarachnoid hemorrhage, what you will do at this point, I would like to keep you in the hospital for the CT scan. I will do a CT scan, and might, on the basis of result, I need to speak to specialists, neurosurgeons. What they would do, they would review your CT scan, and according to the results, they would, in the best case scenario, if the CT scan don't show anything, again, it's not very sensitive test, what we might need to do another test, lumbar puncture, or maybe the neurosurgeon specialist might consider another test. We can start on some medications like nimodipine, fluid, and educator analgesia. Management of GCA, in this one, if you have eye symptoms, then you have to refer, the patient have eye symptom, you have to refer to the eye team urgently, okay? And start high dose steroid. In GCA, in PMR, you'll start with high dose steroids, and you will tell them we'll give you steroid cord, and you don't need to stop it. Why you don't need to stop it? Explain them. Then about the rheumatology referral, you need to refer to the rheumatologist as well. So how many headaches was in that sketch? Can anyone tell? Number of headaches. Again, let me go through after that with that. We got migraine, we got menstrual migraine. 2. We got sinusitis. 3. Okay. And what we got here, stress headache, band-like headache. What we got is carbon monoxide. 5. Okay. And apart from that, we got GCA. Okay. Sinusitis, we already told. And migraine, cluster headache. These are the hangover headache related to alcohol, subarachnoid hemorrhage, GCA. And guys, yes, all of these headaches do come into them, MLA and PLAB2. All of these headaches are basically the part of UKMLA content map. So I'll stop sharing my screen. So I would like to ask Gul to add anything about the headache. Then we'll start doing simulation one by one. I'll share ebook as well. Yes, Gul.
Yes, pretty much covered almost everything, Dr. Zeeshan, but I would like to add one thing that is very important here, that sometimes if the headache is for a longer period, maybe it is for 3 days, 4 days, 5 days, but more than a week, then very important it is to ask the effect of symptoms on the patient, the effect of headache the patient has on someone, right? And again, I will emphasize on that the history, excuse me, the history in headache is very, very important. This will lead you to the diagnosis. As he said, even that what is making it worse, sometimes you forget it, that it's not really important. What makes it better? You need to know these questions, and you need to know the answers, like the patient simulator. Yes, you can ask by this that how are you coping. The simulator might ask you, like, what doctor, what do you have in your mind, like what doctor. Then you need to know that what you have in your mind and tell the patient that, for instance, bending it forward makes it better. All right, so you need to have these questions in your mind. You need to go through, this is a very well made algorithm, so follow this.
Right. So Dr. May and Dr. Gul, so what we're gonna do now, we're gonna do a calibration. I'm going to give you one scenario. So in one scenario, you will act like a doctor, in one I will. So May, you are here, so we'll just, what we're gonna do now. So let's do one headache scenario, and let me give you one scenario. So out of those headaches, so you're about to see a 23-year-old female, 23-year-old female who come with the headache, okay? Who come with the headache, okay? And she do have blurry vision. She do have blurry vision. She do have blurry vision. And along with that, she do have blurry vision. And along with that, this problem is related to her menstruation. Okay, these are the positive findings. She tried paracetamol, which is not helping. She tried paracetamol, which is not helping. And she is too much in pain and she's not happy with the treatment. And she wants something to get help with that. She wants to know about the diagnosis. And she wants to know, is that a brain tumor? And she wants that CT to be done. So if you ask those concerns, she will reply to that. Okay. So May, are you here? No. Okay. Let's start doing it. I will be the patient and you will be the doctor. Good. Can we start?
Okay. Yes.
May is here. Okay. May, have you got the calibration? Because a few minutes.
I'm sorry, I couldn't catch it.
Okay, let me tell you. So you are going to act like a patient. So I will be examiner here. You would be the patient and Dr. Gul would be the doctor. And the scenario is 23-year-old female headache. Okay, blurry vision. Headache is related to the menstruation. Okay, and she tried paracetamol, which is not helping. And she's worried. She wants to know what's going on, what her diagnosis. And she's worried it could be tumor and requesting for CT as well. And she wants the treatment plan for her. Okay. So I'm gonna do the timer and you guys start.
Okay, can you hear me well before we start?
Yes, I can.
Okay,
I can.
thank you. All right.
Just a minute.
Yeah.
I'm going to start the timer. Just give me 1 second.
Okay. Oh.
I'm 25-year-old, right?
Yes, 23. Yeah.
23, okay.
So
Enter the room.
Gul, you can start.
Hello, I'm Dr. Gul, one of the doctors treating you here.
Okay, hello.
May I know your name and age, please?
Yes, my name is Mary Smith and I'm 23 years old.
Nice to meet you, Mary Smith. Can you please tell me how can I help you today?
Well, you know, doctor, I've been having this headache. Yeah.
Okay, and